हेलो फ्रेंड्स। एक बहुत ही इम्पोर्टेंट टॉपिक है, कोविड-19 कब खत्म होगा, when it will end. We all are dreaming of that again life which we used to live, but every freedom has to pay its price. So when it is going to end is important, or how is it going to? It's how it is going to, then that will make it possible. We all are collectively doing every effort which we can to fight against the corona, and I know the panic situation which has been created is unparalleled. This second surge has been occurred because of some mutation, because of casual attitude, because of narrow coverage vaccination program, which now government has taken action from 1st onwards, we are going to have vaccination on a bigger scale for age above 18 years, but still the vaccination for children and kids pending. So these drugs, IV drugs, remdesivir, oxygen and these ventilators, although they decrease the mortality, but they are still temporary measures. They are not going to solve the issue permanently. What can be done? This second wave will go down with its natural course. We have to follow certain steps, like strict lockdown of 40 to 60 days is must, and then selective lockdown where the cases are high. Apart from that, the vaccination program has to be given the speed. I've already told you, the age has been now come down to 18 years. So as much as population can be vaccinated, it is good, as it has been found that if the countries where the vaccination has been done up to 70 to 85%, the situation has been really been under control. And for that, herd immunity to develop, at least 70% should get vaccinated and develop that sort of immunity. So that I believe only possible if we will increase the sphere of the vaccination. We will decrease the age as much as possible, and for children also Pfizer and Moderna companies are working hard. Now they have done the screening, they have done the vaccination for above 12 years of age, and maybe in future around 1 year we can get soon vaccination for children and neonates too. But within 6 months, I hope we can get vaccination at least for kids above 12 years and school-going children too. But apart from that vaccination program, our responsible behavior has to be there, and it will carry a lot of importance. No stocking, no piling of the oxygen, proper wearing of the mask in crowded places, and it's nowadays it is being told that not one mask is sufficient enough to protect you, but you need to wear 2 masks. Even I started wearing 2 masks, and as this is airborne infection, don't loosen your mask in public, and then put your mask off even when there is nobody around you, because it is airborne. The virus might be in the air, somebody might have sneezed, or who was infected might have gone through that area, and this one mistake of putting off that mask can risk your life to get infected, and this infection can again be spread by you to others. Also, asymptomatic cases should be tested. So we should have test as much as possible, and we should screen, and if found positive, we should isolate those cases. That's of paramount importance, and it is urgent situation to screen on a very big level. We are hiding the asymptomatic cases. They feel they are healthy and they are spreading the virus like anything, and the second wave is mostly because of such cases. The people who are asymptomatic are spreading the infection, and after 7 days it seems that lungs getting involvement. Before 7 days, even if you get done HRCT test, it seems it is normal, and if you get done your test like nasopharyngeal swab, RT-PCR, it comes out to be positive. So not one modality of the test is just sufficient, but not all should be gone through this radiation hazard CT scan. That's what I advise. Apart from that, People should do all preventive measures such as chest physiotherapy. If people are feeling symptomatic and their saturation is fluctuating like nearby 94-92%, they can lie so in prone position on their tummy, on their abdomen for 30 minutes to 1 hour, say 2 hours in a day. And you should do each and everything which you can do on your own when you are at home and you are not getting like admission to the hospital. So 2 masks, wear spectacles, just physiotherapy, breathing exercise, good immunity, watch your oxygen level, watch your temperature, follow strict rules of lockdown, maintain the distance with your peers if you are feeling suspicious of your infection, and also people are now wearing masks at even home so that if they are asymptomatic, the infection could not be spread from them to their family members. So many scientists, doctors have made artificial intelligence algorithm through which they have found that actually at least 1.5 years would take if we will strictly follow every protocol along with vaccination, and the second wave will soon subside like within 1 month by strict adherence of our lockdown, and there would be some sort of decline which is being perceived by some algorithms. As we know, these peaks are in form of bell-shaped curve. So there is a resurgence of like around 3 to 5 lakh cases, maybe 8 to 10 in future, and then it will come down again back to the normal or as low as possible, even if it is normal. So this virus is going to live with us even lifelong, but with proper vaccination program, with proper nutrition, with proper knowledge now we have gained through all these years regarding this virus, how it behaves, how it acts, and we have become really more aware of the pattern of the disease which we are having, and we have become quite intelligent. We have to become more intelligent than virus is becoming like intelligent by doing so many mutations, trying to inhabit our system and harming our system. But we have to really be more intelligent this virus by inducing immunity by vaccination, by our nutrition, and last but not least, our willpower is going to give us a lot if we have positive attitude that we are all going to fight with this virus, and soon we will overcome this panic situation or epidemic or pandemic. Then I do feel that there is no way that we can get full control over this virus soon. So maintain a healthy aptitude and attitude, nothing else, and don't get panic. And I appeal to even patients and the relatives not to harm doctors, as doctors are doing 24/7 all their duties. So kindly please maintain decorum. Don't put your rage to something. Don't feel as if doctors and hospitals are not taking care of. Everybody is in helpless situation. We must understand this and we must support this, as doctors, families and hospitals, staff families are also going through this situation. Lack of availability of the oxygen beds, lack of ventilators, lack of ICU facilities because of so much densely population, so much intense population we are having, and that too with limited health resources. We were not expecting the second wave to overcome us in such a rapid way, and that was the greatest mistake. I feel now we should be quite intelligent enough to cater the needs, deficiencies, whatever the needs we are having. Also, scientists and so many other workers, they are working on getting other alternatives of oxygen, like from hydrogen peroxide, and these things are on the way. Let's see what happens. So we must do each and everything to gain that knowledge regarding this mutation, regarding this vaccination, how the oxygen can be given, and with our behavior, along with our behavior, and that will create huge difference. And I feel this fight is not of I, this fight is not of you, but this fight is of us. We will fight together and we will win together. There is nothing which can't be really being won and which can't be controlled. Only with your intellect, with your willpower, you can do each and everything. I pray and wish you and everyone a healthy life. If you really like this sharing of the experience, kindly like and subscribe my YouTube channel. And also, if you want to suggest some important good things from your side, which you feel really can help to end this, you can put your things into your comments. Thanks, and wish you a happy and healthy and wealthy life. Thanks a lot, friends.